Hello everyone. Today we will discuss on sinus rhythm. Disclaimer. The medical information provided on in Arash channel is for education purpose only and not intended to substitute medical advice, diagnosis and treatment. Please always consult appropriate professionals before taking any actions. Okay, let's come to our topic. So, physiological definition of sinus rhythm is a rhythm that arises from the sino-arterial node and is transmitted to the ventricles via the atrioventricular node and his Purkinje system. As a result, it is regular, narrow, complex, and rate ranging 60 to 100 beats per minute. This is the physiological definition that arises from the SCA node. When we say rhythm, it is 3 consecutive heartbeats displaying identical waveforms on the ECG. So when we interpret ECG, we need to see at least 3 identical waveforms. If the waveform that we are seeing is less than 3 QRS or 3 P waves, it's difficult to comment on the rhythm. So we need to see at least 3 waveforms. That's why we say rhythm is 3 and consecutive heartbeats and 3 and more than consecutive heartbeats. So if these 3 or more consecutive heartbeats are originating from anoctopic focus, not from SCA node, then we say it's ectopic rhythm. So in such time, the pacemaker will be replaced by that ectopic focus. So then we call that rhythm escape rhythm because it is escaping from the SCA node. So that's why we say escape rhythm. So as we said previously, a rhythm that arises from SCA node and transmitted down to AV node and Purkinje fibers is called sinus rhythm. That's the physiological definition. But on the ECG, to say a rhythm is sinus rhythm, there are criteria that should be fulfilled, and these all criteria should be fulfilled. 1. Each KRS complex should be preceded by a normal P wave, and each QRS complex duration should be less than 100 milliseconds, and the P2P and R2R interval should be regular, and PR interval should remain constant and duration less than 200 milliseconds. If it is more than 200 milliseconds, we will consider other things. If the P2P interval, R2R interval is not regular, then the rhythm is not from the SCA node, it may be from AV block, from the other things. If the QR duration is more than 100, then we may have some block and the rhythm may not be from SCA node. And if the KRS is not pressed by P wave, definitely, then the rhythm is not arising from the SCA node, it's arising from lower down. That's like ventricles. And the other thing, P wave in lead 1 and lead 2 should be upright, and in lead AVR should be negative to say the rhythm is sinus. Sometimes if there is leads reversal right and left, arm lead reversal, we may find such cases, but we need to rule out lead reversals before we say that this rhythm is not sinus. And to say sinus, the rate should be between 60 to 100. If the ECG rhythm fulfills all criteria, but only the rate is not fulfilled, then we say sinus bradycardia if the rate is less than 60, and sinus tachycardia if the rate is above 100 beats per minute. So from this picture, from this ECG picture, as we see, there is RR interval regularly coming almost every 3.5 boxes, and P2P interval similarly regular P wave is upright. Actually, we can't comment on lead 2, lead 1 and AVR because it's single rhythm lead. But each QRS complex is pressed by P wave, as we see here. And the QRS complex is narrow, almost 2 small boxes, that means almost 80 milliseconds. And rate is almost, if we divide 300 to 3.5, it's almost less than 100. So that's sinus rhythm. Here we see lead 2 P wave is inverted, lead 1 and lead 2 P wave is inverted, AVR P wave is upright. So definitely this is not sinus rhythm, and the rhythm is escape rhythm below the atria. And we are like considering that this is not arm limbs ECG leads reversal. If there is reversal, then after correcting that we will check it again, but this is one feature of non-sinus rhythm. So there is also another feature that's benign that can be seen in young and healthy individuals, that's called sinus arrhythmia. It is a physiological P2P interval variation during respiratory cycle. During inspiration, vagal tone is decreased and there is relative tachycardia, and during expiration the vagal tone is increased, there is some bradycardia. So when there is sinus arrhythmia, we will see P2P interval variation of more than 120 milliseconds, but there is constant PR interval, there is normal P wave, and other sinus rhythm features are maintained. This occurs during respiratory cycle. As we see here, during inspiration there is narrowing of RR interval, and during expiration there is relatively widening of the RR interval. So this is sinus arrhythmia. So we will compare it with the breathing cycle. If there is they are put on the monitor, we can see the breathing waveform and the ECG waveform, and we'll compare when is coming this relative P2P interval variation. And this sinus bradycardia, definitely the R to R interval is 6.5 large box. If we divide by 300 to 6.5, it's 46 beats per minute. We will come to how to calculate the heart rate. So if we divide number of large boxes, 300 to the number of large boxes between R to R interval, we will find the heart rate for regular rhythms. And this is the sinus tachycardia. As we see, there is almost 2 small boxes, 2.5 small boxes, so it's more than 100, so that's sinus tachycardia. So our today's lesson on sinus rhythm is done. Have a nice time.